This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday morning on WAJR. Thanks for joining us. I'm Kyle Wiggs. We are joined this morning by Dr. Anand Chockalingam, and he is with Charleston Area Medical Center. Charleston Area Medical Center, that's where Dr. Chockalingam is based out of. And first of all, good morning. Thanks for coming on. We appreciate your time.
Good morning. Thanks so much for inviting me, Kyle.
Let's talk about your facility. I believe this is one of the first times that we've had a guest from CAMC on our program, and of course the partnership with Mon Health Systems and CAMC in developing Vandalia Health. How has that partnership in your mind? How has the transition been, and what's it been like?
It's such a exciting time to be in medicine within Vandalia. I'll tell you why. For the last 20 years, my interest has been trying to understand what causes aging, how we get older. Unfortunately, many of us get older sooner than we should. That is called biological aging. And what we see in West Virginia is a lot of mental stress, physical, metabolic problems, including high blood pressure, diabetes, extra weight. All these things contribute to accelerated biological aging. And for 20 years, I worked in Missouri, where we did research on this. And at CAMC, about a year and a half ago, I came, saw this place, and I fell in love with Vandalia Health because of its approach, which is integrative, trying to bring in resources from so many different centers within West Virginia to try and help our community. So I was excited to start, and my journey for the last year and a half within Vandalia, by the time I joined, it was already Vandalia Health. So I've been trying to help patients all across our state using the best resources we have, telehealth and virtual care and heart failure methods that we employ. And for me, this last 1.5 years have gone by like one day.
It's gone quickly. Okay, so you say you've been in this specialty, or you've been in this for 20 years. Where are you originally from, and what brought you initially into the Vandalia Health System?
I'm from India, southern part. Chennai is my hometown. That's where I went to medical school. And then I trained in Pittsburgh. My interest in premature heart failure started with my work in Missouri, where we did evaluation of the heart using non-invasive methods like stress testing, echocardiogram, Dopplers, and non-invasive ways to evaluate how the heart is aging. And when we got good at not only evaluating this, but also we tried different lifestyle and diets and exercise regimens. Over the last 15 years, we kept getting better and better. And by the time the pandemic came, 2020, 2021, the results were so good that it needed an opportunity to grow and scale. And Vandalia was the perfect opportunity because the cardiology as well as administrative leadership of Vandalia is innovative and genuinely looking out to help the community. So that combination was what motivated me to come to Charleston.
Okay. And your specialty, as you mentioned, heart-related issues. What drew you to that specialty in terms of being interested in the heart and helping people that are having issues in that regard?
This is very important to me because cardiology, we feel, is a very, acute care type specialty, where it's a question of people coming in with chest pain or trouble breathing, and if we don't take the right decisions, minutes can mean life. So the acuity and the challenges with imaging, interventions, procedures, all this attracted me to this field, and that's how I became a cardiologist. But once I became a cardiologist, what was apparent to me and is now becoming evident to the medical community and the broader community at large is that the heart is not a specific standalone organ with its valves and blood supply and electrical supply, which is what we specialize in. But the heart is so intricately connected with everything else. If the heart were to work well, everything else would work well. I'm talking about the liver, the kidneys, the brain, the lungs. So if the heart were to fail, it's like the engine. Once the engine is gone, the car is not of too much value. Like that, once the heart is not working well, other things tend to fall apart much sooner than they otherwise would. So this integration with the whole health was what has motivated me and my research and patient care and innovative programs that I've built.
Mm-hmm. We are with Dr. Anand Choklingham. He's a cardiologist with CAMC, Charleston Area Medical Center, part of Vandalia Health. Of course, the partnership between CAMC and Mon Health Systems in Morgantown forming Vandalia Health. Doctor, we brought you on here specifically to talk about premature diastolic heart failure. Can you define that for us?
This is sort of new, even for cardiologists. When I went to medical school in the 90s, for the heart to fail, people had to have several heart attacks or viruses affecting myocarditis or alcohol, which, when used excessively, ends up weakening the heart. Ejection fraction, the squeeze of the heart, is easily measured with an echocardiogram, and if it is reduced, the ejection fraction normally is about 55 to 65%. If it is reduced to say 30%, 20%, that is when we expect people to develop trouble breathing, chest pains, dizziness, extreme fatigue, and swelling in their feet, not able to do their routine work, getting hospitalized with fluid backing up in the lung. This is life-threatening, decompensated heart failure. So we expect that when the heart squeeze is down. Only in the 2000s, we started recognizing that the heart can fail even when the squeeze is normal. So this was a huge paradigm shift for cardiologists, let alone the general community. But we recognized very quickly that nearly 2/3 of all heart failure, the heart squeeze is normal. So this is what we call diastolic heart failure, when the squeeze is still 55%, but the patient's heart has theoretically or practically failed. And most often, luckily, this happens in people who are much, much older with other issues, not able to get around because of arthritis or stroke and dealing with kidney issues, lung issues, well into their 80s. And this we sort of support with blood pressure control and water pills to get rid of the fluid. The area that I focused on for the last 20 years, because of my interest in premature aging, accelerated biological aging, has been premature diastolic heart failure. This is seen in people who are in their 20s sometimes, but oftentimes 30s, 40s, and 50s. This is way below any age range that cardiologists even get to see patients. I get to see them because I'm looking out for this problem. And because we have a specialized diastolic heart failure clinic here in CAMC Charleston, I get referrals from actually all over the country for further evaluation and management of this very challenging situation. The best part of this premature heart failure, although it is occurring with preserved ejection fraction, which means the squeeze is good, you cannot do a bypass surgery or stent because the squeeze is fine. But because it is premature, happening in the age range of usually 30 to 60 years of age, we oftentimes can make a big difference in their long-term outlook by engaging with the patient and their families, empowering them, and working with them towards reducing their risk, along with the best technology that we are having in this day and age. So this is my focus area. Premature diastolic heart failure. The squeeze is fine, but the heart has failed before the age of 60.
Very good. We need to get a break in here, and we'll talk about the causes for this and how you might reverse it. And we're with Dr. Anand Chalklingham. He's a cardiologist with Charleston Area Medical Center, and of course, Mon Health and CAMC forming that partnership known as Vandalia Health. We'll take a quick break. We will continue the conversation with the doctor after this. Stay with us. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday on WAJR. Thanks for joining us. Our guest, Dr. Anand Chalklingham. He is a cardiologist with Charleston Area Medical Center and part of Vandalia Health, of course. And doctor, you did a great job in defining diastolic heart failure at the end of that first segment. So the next questions are, what are the causes and what are the symptoms, and how can you help reverse some of those symptoms?
Excellent, Kyle. The diastolic heart failure may not have much to do with the heart itself. What I mean by this is, because of the physical and mental stress that the heart is being put through for years, sometimes decades, it starts giving up pretty soon. Instead of the 90s, in the 70s, sometimes in even 40 and 50-year-olds. So how does this manifest? People get fatigued, out of breath, walking any length of distance or climbing stairs. They think they are deconditioned. Sometimes they get leg edema, lymphedema. They might think it is just fatigue and deconditioning. And they may even be on water pills like furosemide, Lasix, torsemide. These medicines, along with blood pressure pills, they get added on over a course of several years. And yet, the echocardiogram, if it was done, might look completely normal. So this is the challenge that medical doctors and even cardiologists oftentimes face, because this diagnosis is not apparent. And these symptoms that I mentioned, I invite them to talk to their doctor and ask this question. Because of my age, say being I'm in my 40s or 50s, and because I'm having more trouble breathing in the last couple of years, and slowly I'm needing more water pills, could this be a form of heart failure? So when a patient asks this question to his doctor, when they go and look at the cardiac testing a little closely, they may refer to a specialist. Sometimes pulmonologists put people through specific testing in the cath lab, which we are starting to do at CAMC. Oftentimes it is a cardiologist who needs to get involved and evaluate the patient, not just the imaging, and talk to them to make a more comprehensive approach. So now, starting 2023, we are training our cardiology fellows to evaluate this appropriately. And we teach this at American Heart Association, American College of Cardiology, so that nationally the awareness will grow. This condition is prevalent all over the world. It's just that we are now only waking up to premature heart failure. And in the next 5 to 10 years, we are going to see a lot more research and evidence gathering in this space. And special thanks to the newest weight loss agents, tirzepatide and semaglutide, Ozempic and Mounjaro. These are increasing awareness not only among the public but also among doctors about the potential of reversing metabolic problems, like, for instance, losing, say, 20-30% weight and cutting down the blood pressure and diabetes control getting better. All these things directly translate to so much improvement in heart failure symptoms. So this correlation is now for the first time showing us that this is where we need to focus moving forward.
Okay. What can you tell us about the ACE program or the ACE program?
Yes. So this is something that we started only about 5 years ago. It is called the Advanced Cardiac Energetics. So the energy that we are trying to fuel the heart with, for the first time in many people's life, they may be sometimes in their 40s, sometimes even in their 70s. Once they learn this program, their heart gets to work on ketones. This is separate from ketogenic diet. This is separate from any other particular lifestyle or dietary intervention. And we developed this thanks to so many patients in the last 15 years, showing us how much they can reverse not only their heart failure, but also so many of their comorbidities using this natural ketosis. The way to enter into this natural ketosis is by learning with the patient's family, going through some of our online material, making healthier diet choices. It does not require extreme exercise or pushing your body to its physical limit or not eating for prolonged periods or going into a specific keto diet, but it can be done naturally within our own day-to-day life. So that is what we are trying to bring in with the right personalized technology so that people can find how they might embrace these simple holistic methods that have been there in all cultures across the world for thousands of years. So what is novel is the way we put it together as a program and make it accessible to our community. So this natural ketosis, for instance, for me, my heart was fueled by 3 fatty acids and glucose. That is how most people's hearts are for 45 years. And now, for the last 6 years, my heart is about 20% of the time fueled by natural ketones. Mm-hmm. So this allows me to play more tennis than ever. I love to play tennis into my 50s. So for me, it is about being more physically active and able to do things that I love. And for heart failure patients, it can mean so much more, that they can breathe and stay out of the hospital and have a much better quality of life.
Absolutely.
So this is the Advanced Cardiac Analytics Empowerment Program, which patients and families, they seem to embrace it within a few weeks. And once they learn it, it's a lifetime, I would say, fun to participate and engage in these holistic methods.
Okay, we're very good. We're down to the final couple of minutes here, Doctor. If someone's listening and they're interested in this, how can they find out if they would be a good candidate for this ACE program?
This program we have now started offering, as I was saying, to anybody with insurance or whatever they are dealing with. Anywhere in the country can see us virtually, because oftentimes for the ACE program, people have already been evaluated by their medical doctors, cardiologists, pulmonologists, and then they recognize there is diastolic heart failure, and they are usually below the age of 70 when they get referred to this program. But if people want to directly reach out to us, the best way would be to call our office. The number is 304-205-7992. And my actual office is in the Cardiometabolic Center in South Charleston.
Okay. And again, that number is 304-205-7992 for the ACE program. Doctor, we appreciate your time. That's great information. And again, we hope to talk to you more about this, but it was good information today. Thanks again.
Such a pleasure. Thanks so much, guys.
Dr. Anand Choklingham from Charleston Area Medical Center. And again, as you followed this the last year or so, Mon Health Systems and Charleston Area Medical Center, again, a partnershipちunique and a very productive partnership known as Vandalia Health. And, of course, Dr. Choklingham, a big part of that from CAMC. Thanks for listening. That's Mon Health Talk for this Monday. Stay tuned as we continue on here on WHAR.
A global stage right here in Morgantown. Don't miss the action. The USA Diving American Cup welcomes elite divers from Japan, Australia, Canada, Korea, and more to the Peak Health Aquatic Center at Milan Park June 12th through the 15th. Grab your tickets to see the action live or step behind the scenes as a volunteer and be part of an international sports experience happening right here in West Virginia. Dive into something unforgettable. Details at milanpark.org.
Thy ticket, Lady Jennifer of Coolidge.
Well, many thanks, good sir. Hereeth my Discover card. They accept Discover at Renaissance fairs?
Yeah, they do here. Discover is accepted at the